Hey, Stuart, Tomlinson, Warrior Collective. We're back once again, InsideChat. I'm excited to be back for another episode, and especially in this series where we speak to some of the UK's leading sports scientists, doctors and professors on a number of really very interesting topics. And today's guest is no different. We have Dr. Valentina Pietro of Birmingham University, and we're going to be speaking a little bit more about how concussion affects athletes. Hi, Valentina, how are you?
Hello, good morning, and thank you very much. It's a pleasure to be with you today. I'm very well, thank you.
It's great to have you on. Just for those listening, can you tell me a little bit about yourself and your role at Birmingham University?
Sure. Okay, so I'm a molecular neuroscientist. I have a background in biochemistry and genetics. I'm a lecturer in neurotrauma at the University of Birmingham, and I do research on traumatic brain injury at the University of Birmingham.
So obviously that particular area of sports science is possibly not to everyone's taste who goes into your field. What drew you to researching the effects of brain injury and concussion?
Yes, basically this is a passion that has been passed on by my supervisor when I was a PhD student at the Catholic University of Rome. I was during my career, because it's around 20 years that I'm working in this field. I started to work with the animal model of traumatic brain injury in rats. So just a wave drop model of TBI, and I was absolutely fascinated to see the results of what happened in the brain after you get multiple hits. So that was the start of my story in this field. Once I started, basically I never left this field of research, and moving from the molecular mechanism and pathways and things that happens in your brain after concussion, till to the most recent part of the research, where basically at the University of Birmingham we are collaborating with sport federations, including the Rugby Football Union, where basically are trying to identify a molecular signature to make a proper and clear diagnosis of concussion or mild TBI, which is one of the main challenges at the moment in this field of research.
So you talk about concussion and TBI. How do you define concussion then in a sports environment? Is there a definition of it?
Yes, of course. A concussion is also named and called as mild TBI. It basically is an injury to the brain which results in a temporary loss of normal brain function. So any bump or blow that happen to the head that make your brain moving back and forward around the skull, and then that make the brain bouncing around or twisting, basically can cause a cascade of chemical changes, which basically will lead to damage of the cell of the brain. Now, despite the nomination mild traumatic brain injury or concussion, as we said, it's important to say that nothing is mild in mild. It is true that it's not a life-threatening condition or pathology, but the consequences that you can get after a mild TBI, especially if you are subjected to repetitive occasion of mild TBI, can be deleterious and can lead also to death.
So you mentioned rugby a second ago. Obviously, concussion can happen in every walk of life, in every sport, but there are certain sports that you find this regular concussion more than others?
It obviously the contact sport presents the highest number of incidents, but as you said, I mean, that is not only related to the contact sport. For example, the jockeys or horse racing, it's also a sport where you can see a high incidence of concussion as well. So it can happen. It can happen in all the sport. It can happen in the normal life. So it's not only related to the sport field. It happens a lot in children, for example, which they generally gets a lot of concussion in the military context as well. So my research is focused on the sport related concussion, but actually concussion can happen to anybody.
And I guess, when we talk about sport, a lot of people think about injuries as in broken arms, bruises, cuts, but a lot of people don't really think about injuries to the brain. They just see what's on the external. How do you see, what are the effects that regular sports-based concussion can have on an individual then?
Well, basically, a subject which might have multiple concussion during their career basically have an higher risk to develop later in the life neurodegenerative condition, which I'm talking about pathology which similar to Alzheimer or dementia, basically. The main pathology which has been associated with the sport concussion is named as chronic traumatic encephalopathy, which is very similar to shares a lot of features with Alzheimer's. Actually, it's a form of progressive dementia. Of course, we cannot say that all the players will develop this kind of pathologies, but of course there are sports where, like for example boxing or rugby or rugby players, which have a greater chance to develop this pathology. The thing is that at the moment, for example, the diagnosis of this pathology can be done just post-mortem, so it's difficult to assess. And they can be developed also later in your life, not immediately after your brain injury, so you're going to see the effect later. And there is no cure at all at the moment. There is no cure for this pathology. The only thing you can do is prevention, basically. So try to protect your brain as much as you can. This is the only thing. It's also true that, as I said before, not all the players will develop this pathology. Of course, it has been estimated, for example, that in boxing, for example, 20% of the boxers they can develop this pathology. But again, still to estimate this number is difficult because, as I said, the only clinical diagnosis you can make it is after is post-mortem. But there are lots of things also that can influence the development of these pathologies, like genetic factors, for example, and also exposure risk, for example, the number of matches you have done, for how long you have been playing, the time of retirement, the number of concussions you have experienced in your life. There are lots of things that can, of course, increase the risk of generating this neuropathology or this dementia-like condition.
We've mentioned that, obviously, the effect. How much is the risk heightened through each subsequent occurrence then? So let's say rugby or in boxing where, you concussed on this, incident, this event, and then let's say 6 months later you get concussed again, or even, more concurrently than that. Does it increase with each particular one, or do the risks remain the same?
It's a difficult question. This is actually, for example, for example, if I recall my animal study, when we have observed the changes in the brain after repetitive concussion, what we have found that after a mild TBI, you have we call that a sort of metabolic depression. So you have a sort of molecular changes in the brains, which basically where the level of these molecules decrease temporarily and then return back to normal after a period of time. The thing is that if you, in this window, which we call window of vulnerability, you receive a second concussion, one basically while all your molecules are depressed, you don't recover immediately, and the damage of your cell becomes cumulative. So that's why you basically prolong your symptoms. Instead, basically, if you receive a concussion when your brain is fully healed, basically, so when you recover, these are considered as two independent episodes of concussion. So it's less important, let's say, the damage that you can get. So it's the key of is the prevention in this sport, especially. It's really important, because basically, if you get a concussion, something is happening in your brain. You can recover naturally without any cure, just resting for a period of time, and then return to play or to do your normal life. So the key is recognize, have something clear. The clear it can make you a diagnosis of concussion, which is, as I said before, a challenge for the moment in science, because the diagnosis only relies on neurocognitive tests. There are, of course, high standard tests that are used especially in professional sport, but still is really difficult to understand. Except from the observation, if you got a concussion, there is not a specific molecule that can tell you, to make you a precise diagnosis of concussion. So of course, if you have multiple concussions which are in a time frame, as small time frames, the risk of getting a major damage is higher. If you can keep well separated, I mean, still the risk of having a major neuropathology is there, because of course there are also other components that can intervene, like for example also genetic factor, as I said before. So it's difficult. It's really difficult to reply this question. The only thing that you can do is that we know is when you show sign or symptoms of concussion, you need to rest and not play for a while, and need to be sure, have regular check, have regular testing, screening tests to assess how your cognitive, if your cognition, so and to be sure that you are able to return to play before. This is the only thing that basically at the moment we can say. Recognize and stop and remove from the field until you fully recover.
And I guess that might be the problem then, because obviously a lot of athletes will not want to come off the pitch, will not want to stop the fight, whatever contact sport they're trained in. So they might have a concussion during training, during their competition, and not come off the field, and then risk, especially in striking sports like boxing, that repeated trauma in a concussed state, and so if when in those instances, then I'm guessing that the danger is exponential.
It is, but for example, just because you mentioned the boxing, it is true what you said, but if you compare, for example, the statistics between professional and amateur boxing, the number of concussion of the injuries that you have in amateur is much more less than in professional, because of course there are ways you can in some way help the prevention, like for example the acting on regulations, protecting gear, even this is still debatable field, because I mean there are controversial information about, or literature about the fact if helmets can protect from concussion, prevent from concussion. But for sure, since you use it, the numbers of facial injuries has decreased. So there are things that we actually can do to prevent the risk.
So for those coaches or even athletes who are involved in contact sports, what should they be looking out for in terms of to know if they are concussed or their athletes concussed? Because I'm guessing that's where a lot of maybe sporting bodies and groups fall down, is the education of the signs to look out for of concussion. So if let's say I was a coach and I've got an athlete training in martial arts or boxing, for example, and there are blows to the head, how can I differentiate, the concussion from just fatigue, for example?
Well, there are methods to making an assessment of concussion. Of course, you need to search immediately for medical advices. For example, having a regular screening test. They can help to understand the level if you have any sort of damage in your brain. So I have to say that today both athletes and coaches are already aware of the potential risk of concussion. So there is a certain degree of attention now to look at the symptoms or the potential sign of concussion compared to a decade before, of course, I'm talking. So the key is to have regular checking, to for example in amateur boxing as well, they have a record book where they report any result from the test for any match and any so basically collecting the data and establish like a metric to prevent any potential further injury or concussion habits.
Yeah, I think in professional sports and even maybe higher level amateur, there will be these checks that happen. But I guess what I was referring to was, let's say someone's in the gym or on the field training, and you have got no, because in normal training facilities, you don't have medical people there to check. So
exactly, that's exactly the point why here in Birmingham we are trying to develop an objective test, a molecular test that is not only based on the competence of clinicians or the coaches and the athletes themselves, but it's an objective test. It's a saliva test, so we have tried to identify some sort of signature of these molecules that can tell you clearly if you have been injured or not, and if you need to rest or not. So that's basically is the main point of this field, because if we have a clear test for making a clear diagnosis of concussion, then of course it becomes easier to manage the return to play for them, even if you are not in higher professional competitions. For this is a test that can be used by everybody.
So until that kind of process is finished, then is there any physical signs that maybe infer that concussion has taken place that a coach or an athlete looking out for another athlete could watch out for? Is there any warning signs that you can kind of say, oh well, if this is happening, you really need to get medical attention?
There are all clinical manifestations which make the diagnosis of concussion at the moment. The thing is, this is why it's tricky, is that sometimes these clinical symptoms can appear not immediately after the concussion, but even 2-3 days later. And also the fact that are very common symptoms, like for example nausea, vomiting, or headache. So sometimes it's also even difficult to reconnect or link your symptomatology with the episode of concussion that you had 2-3 days before. Yes, you need to of course to pay attention to anything once you know that you had the hit into your head. You need to pay attention for the coming weeks about potential clinical manifestation, and if you think you have it, then report immediately to the doctor that will do other kind of investigation.
So if you were feeling that you or your athlete were possibly, or even if you were a parent of a junior athlete, a child, and you felt that maybe they were having headaches or there was some kind of, incident where they'd clashed heads, just take them to the doctor or the hospital and get them checked out.
Yes, basically, yes. Regular screening, regular test, this is the most important thing at the moment to make the prevention. Until we're going to have on the market a clear diagnostic test for concussion.
And you mentioned obviously head guards before, and that's one of the questions I wanted to ask actually, is helmets in American football, head guards in boxing and martial arts. Obviously, like you said, they do negate facial injury, but does the wearing of them negate the impact of the blow for concussion? Does it have any effect at all on that?
Okay, what is present in literature is quite controversial. It seems that it doesn't prevent at all the concussion. Maybe it can reduce a little bit the impact, but it's still difficult to understand what's the value. Anyway, it's always better to wear that, not to do it. But there is still a debate on the fact if using the helmet can help, can prevent the concussion or not. Still a matter of debate.
So, for those sports that for those sports that have that physical contact, rugby, boxing, combat sports, different ones, what are you recommending as ways to mitigate the risks of concussion? So given the fact that contact is always going to take place in their sport, what are your kind of recommendations from the research?
Is try to understand and recognize if you sustain actually a concussion or not. Then look at your symptoms and be aware of the potential serious symptoms that you can develop after an episode of concussion. And basically taking all the medical advices once and do the regular checking, the regular screening and test as recommended by the medical doctors, and of course in this specifically in this contact sport, quit before you sustain permanent injuries. That's the point. So try to understand the point where you are you have to quit and to avoid any further complication.
So how do you think the education of concussion and the risks of it is across all sports in terms of practitioners, coaches, athletes? Are people aware of the risks of taking part in these sports?
I think that now this has become like a hot topic, so there is much more awareness now, and definitely I would say that we are doing something to let people understand the potential risk of multiple concussions. We're getting there. What I mean is that now it's much better, and concussion has become recently a hot topic, and so it means that we are reaching with the science and all the population at all levels.
So in a perfect world, there'd be obviously some sort of medically aware member of staff during training and obviously during competition. But do contact sports such as boxing, do they need to change their rules, or will these other factors mitigate the risks enough for them to carry on as they are?
As I said, I mean, the fact that, for example, in boxing, professional boxing, the knockout is still which is an intentional trauma to the brain. The fact that this is legitimate is still. It can be considered as a problem, but if you basically act on the regulations, like for example they've done the amateur boxing, probably this you can mitigate for sure the risk of neurodegeneration. So definitely the keys are acting on the regulation, the use of protective equipment, improving the refereing and recording, and regular screening.
And I guess, part of that education, and you just mentioned it there about
part of the question is true. Yeah, absolutely.
About the referees and the
Absolutely,
coaches, because obviously a lot of athletes, and especially junior athletes, they're so concerned with winning that they will put that winning of the sport ahead of their own personal health, or even, without being aware of it, the health of those around them. And that's where I guess the responsibility has to fall back then on the coach or the officials.
Absolutely, so yeah, you're right. It's like this.
And obviously, like in football, I think recently they've talked about even just heading the ball has a risk of concussion. And for those footballers who head the ball numerous times in one match, it's the same thing as being punched in the head. And they're talking about negating the use of heading the ball in junior sports.
That's what is happening in the States, for example. Under 16, you are not allowed to hit the ball with using your head.
So how does that then look, if we compare boxing, for example, where juniors are allowed to box with head contact, where do you think that's going to go then? Because obviously they're under 16 and they're allowed to strike and hit the head, and it's the same in other martial arts as well. How do you view that for junior athletes?
Well, here of course, even in this case, it's if you increase the awareness of people, of coaches and trainers and parents as well, involve parents in this topic, then this is going to be the goal.
So I guess really then the whole point of going forward with this, until these tests become more conclusive and the tested, is just educating, being aware, and I guess taking responsibility to end the training or end the match if anything like that is suspected.
Yeah, correct.
So going forward then, are you doing any research on any particular sport such as boxing or rugby with regards to this these long-term concussion?
Well, we're doing our research basically is in collaboration with the Rugby Football Union mainly, but we are also in collaboration with other federations, with the Premier League, with boxing. Still, we don't have many data as we have, or as much data as we have in rugby at the moment. So what we are trying to do is also to look at, because the molecule, for example, we have tried to, as I said, to identify a signature, molecular signature in saliva of rugby athletes after an injury. But still, these molecules are epigenetics factors, so it means that their expressions can vary according to the gender, the age, and so we are basic. And at the moment, the population we have analyzed is only professional male athletes. So we are trying to see if this test can be extended to women, to children, or to normal population as well. And then the other goal would be to look, because at the moment the research, the last 5 years were spent on looking at the diagnosis, not at the management of the long term effects. So this is something that we are also doing now, but of course it takes some time before to look at the long consequences in sports. So it took a bit of year before to make a clear study.
So in boxing, and it's even the terms even used in other combat sports like mixed martial arts, kickboxing. We talk about pugilistic dementia, our layman's terms like punch drunk, punchy, and that's I guess some people have kind of made it not comical, but kind of made it like, that's kind of what happens when you get hit in the head too much. But realistically, these things aren't to be ignored, because it's a bit like the climate. You have these people who denying it happens, and then you have the people who are, this is the doomsday, this is the worst case scenario. So with regards to these effects, this concussion, what, and we talk about, just mentioned pugilistic dimension there, what are the worst case scenarios for someone who ignores the risks with these repeated concussions?
It's exactly the development of neuropathology condition, like for example the chronic traumatic encephalopathy, which basically was described before, as you said, as punch drunk syndrome or dementia pugilistica. This is a pathology that shares a lot of features with Alzheimer's, so it's basically involved mental illness, impaired judgment, memory loss, depression, and till lastly basically dementia itself. What was the question?
Just essentially, what are the worst case scenarios? What's the
So the worst case scenario would be to develop this kind of pathologies. This neuropathological condition, which at the moment have no cure at all. So the only thing where you can intervene is to acting before to develop this kind of neuropathology that can happen years later. You got a brain injury.
So obviously, like I mentioned before, in other things like the environment where you have these two extreme ends, again the truth is often somewhere in the middle, where people have to be aware of the risks, don't they? Have to educate themselves. It's not saying you can't take part in the sport, but in order to do so with a view to staying healthy and to looking after yourself or your athlete if you're a coach, or even if you're a referee or an official or someone in a more administrative role, it's understanding these risks and putting all these things into play into terms of training, competition, to help reduce the occurrences of them. And when they do occur, make sure that individual is resting and recovering, and everyone around them is aware of the impacts of what's happened.
Yes, correct. That's exactly the synthesis of what we discussed today. Yes.
Okay, well, it's been amazing to talk to you, Dr. Valentina Di Pietro. I'm very happy that you spared the time. I really appreciate it. I know you're a busy person. So if anyone wants to learn a bit more about your research or what you're doing in this field at Birmingham University, is there anywhere that they can look, for more information?
Yes, of course. In the website of the University of Birmingham, you can easily find all my research and my profile and all the things that are going around in the sport concussion. Yes, or you can easily get this information from the University of Birmingham website.
And do you have social media that anyone can reach out to you on if they have any further questions?
Yes, you can find me on Twitter, or my name is Valentina TBI. You can find me on Facebook, LinkedIn. Yes, I'm on social
Right, amazing. Well, I'll make sure to write all those links in the section below. But thank you once again, Valentina. It's been an absolute pleasure and an education.
You. Thanks a lot for giving me this chance. It was a pleasure.